The thoracic cage forms the framework to protect our heart, lungs, and other organs. The sternum is the centerpiece of the thoracic cage. The sternum is strategically positioned to act as a barrier protecting the heart, lungs, and blood vessels from physical damage. The sternum is also the attachment site for muscles responsible for movement of the head, neck, and upper appendages. The sternum is located anteriorly along the midline of the thorax superficial to the heart. The sternum is a long, flat bone, commonly referred to as the breastbone. The term sternum comes from the Greek meaning chest. However, in early anatomy, the sternum was known as gladius, a Latin term referring to the similarities between the sternum and a gladiator's short sword. The sternum has three distinct parts: the manubrium, which is Latin for handle, the body, and the xiphoid process. Xiphoid is Greek for similar to a straight sword. The manubrium is the most superior part of the sternum. Many muscles originate at the manubrium, including the sternocleidomastoid, sternohyoid, sternothyroid, and pectoralis major. Located at the superior border of the manubrium, medial to the clavicular notches, lies the jugular notch. The jugular notch is the indentation found on the manubrium. To detect hypertension, atherosclerosis, or an aneurysm, some medical professionals will palpate the jugular notch. A prominent pulse would indicate problems. Lateral to the jugular notch, on the superior border of the manubrium, are saddle-shaped facets called clavicular notches, one on each side of the jugular notch. As the name indicates, the clavicular notches are where the clavicle bones articulate with the sternum to form the sternoclavicular joint. Inferior to the manubrium, and the largest portion of the sternum, is the body. The sternal body, or mid-portion, actually begins in embryonic life as 4 separate bones that fuse together after puberty. Small facets on each border of the sternal body articulate with the costal cartilages of ribs 2 through 7. The anterior surface of the manubrium and sternal body form a synarthrotic joint known as the sternal angle. This joint allows the sternal body to swing anteriorly when we inhale. The sternal angle is inferior to the manubrium and superior to the sternal body, anteriorly and horizontally forming a ridge. Anteriorly, the sternal angle lies at the level of the second pair of ribs. The sternal angle is a useful landmark for locating the second rib. When the second rib is identified, one can count down to identify the rest of the ribs, with the exception of the 12th rib, which is too deep to be palpated. Locating individual ribs is important because each rib acts as a coordinate for underlying organs. The most inferior region of the sternum is the xiphoid process. The xiphoid process is the smallest region of the sternum, located inferior to the sternal body. The xiphoid process serves as the insertion point for the rectus abdominis, an abdominal muscle that flexes and rotates the trunk. At birth, the xiphoid process is composed of hyaline cartilage. The cartilage ossifies and fuses with the sternal body at approximately 40 years of age. At that time, it forms a xiphosternal joint with the sternal body. In some people, the xiphoid process may present with a curve that points posteriorly towards underlying organs. This deviation can cause injury to vital organs, typically protected by the sternum. In the event of an accident, such as a blow to the chest, the curved xiphoid process may puncture the heart or liver, causing massive hemorrhaging. First aid responders use the xiphoid process as a landmark to properly place chest compressions during CPR. Applying too much pressure can cause the xiphoid process to break and puncture vital organs underneath. Accidental injuries to the sternum are rare. When injuries do occur, they are typically caused by significant blunt chest trauma. The most common types of injuries to the sternum are sternal fractures. This injury most commonly occurs during automobile accidents when a person is forced into the steering wheel or dashboard of their car. If a sternal fracture occurs, it usually indicates serious damage to the heart, lungs, and other organs. Open heart surgery requires the sternum to be sawed in half in order to access the heart. The saw is sensitive to tissue and stops immediately when tissue is detected. Surgeons will cut the sternum completely or partially, but they don't remove it. Many advances in medicine have allowed for better repair of the sternum after open heart surgery. In the past, wire was used to stitch the sternum back together. Today, surgeons use customized plates and screws to hold the sternum and ribs in place as they heal. This new method allows for better healing and lower risk of infection. The gladius was used by Roman soldiers to protect themselves from harm, just as the sternum protects our life-sustaining organs. The sternum is also recognized for its versatility, muscle attachment, locating landmarks, and bone articulation. The sternum is the keystone of the rib cage. Without the sternum, the rib cage would collapse. This video was prepared as part of the course requirements of Human Anatomy at Saddleback College.